My name is Maria Boujoli. This week, my patient present with abdominal pain, and the differential diagnostic for this week is acute appendicitis, which is most likely is significant in this case, ectopic pregnancy, which is not a uterine pregnancy, and an ovarian cyst. To begin with, I will be doing inspection. So for the inspection, I'm gonna have my patient lie supine for me. So I'm gonna have you lay face up for me. Alright, lay down everything. So the second step, I'm gonna have you, if I can have you roll up your shirt up into here. I'm gonna have the patient roll up his shirt, exposing his xiphoid process along with his ASIS. For an inspection, the first thing I'm going to do here is visualizing for any scars, any lesion, or anything like that, and clearly there isn't any of that. So the next step, for the next step, I'm going to move to auscultation. For this one, we are going to start with auscultation for bowel sound, and I'm going to be evaluating his right upper quadrant. And I will be going in a clockwise motion. And I'm going to also be using this little object here. I will be using the diaphragm side of my stethoscope. Okay, so basically, while I'm evaluating for the bowel sound, if I hear within 35 minutes and above, that would be hyperactive bowel movement. That would mean that the patient is basically have diarrhea. And in his case, it was so. And if I would hear about 5 to 35, that's pretty normal, and that will be what this patient is in this case. Now, if it were to be about 1 to 4 bowel sound per minute, that would have been hypoactive bowel sound. In that case, it would mean that my patient is constipated. Now, if I didn't hear anything at all while I listened about 5 conservative minutes or so, it would mean that there is an emergency and this patient needs to seek medical care. I'm going to move to the next one. The next thing I'm going to be doing is auscultating for Brut. And for that one, I'm going to be using the bell side of my stethoscope, and because it's a lot more precise, and I'm going to start right now. Alright, so I'm going to come right down here underneath the costal margin. I'm going to be listening to his renal artery. Take a deep breath and hold. All right, I'm going to be moving down to the aortic artery, the abdominal aorta. I want you to take a deep breath and hold. Alright, so then I'm gonna go ahead and move on to auscultating for venous hem, and with that one I'm using my Bell's side as well. I'm gonna come down here underneath the xiphoid process, slightly down to the inferior vena cava. Take a deep breath and hold. Okay, that was auscultating for venous hem. Next is percussion. I'm going to start with percussion of the liver. For that, I'm going to come down here Mid-clavicular, I'm going to use my chiral index finger, and I'm basically going to be looking for the superior border of the liver. And when I percuss, I should hear a dull sound indicating I'm at the superior border. I will then mark the superior border. I'm now going to move to the inferior border. To do that, I'm going to come down here at my non-dominant hand. I'm going to be right here at the level of the umbilicus, and I'm going to move headward. Stopping right here at the costal margin. I will then take my tape measure and measure the inferior border, and the normal size in an adult should be 6 to 12 centimeters. Next, I'm going to be percussing for gastric air bubble. We know that it's somewhere between the breastbone and the mid-clavicular line. Using that to percuss the intercostal space, I should be hearing some type of timpani sound. So I'm going to come back right here. Here's the dull sound. That was for gastric air bubble. Next, I'm going to be moving down to the spleen. And we know that the spleen is like, using a transpyloric plane, I'm going to be finding the posterior border of the mid-axillary line. I should be looking for like a dull sound as well. So back down here. That will be the spleen. All right. So next is palpation. I'm going to start with light palpation. Now I will be starting at the lower quadrant, moving upward. I'm going to be using about 1 centimeter into the tissue for very light movement. And here I go. Starting here, I'm going to be slightly pressing on my wrist. Okay. Again, that's light palpation. I only have gone about 1 centimeter into the tissue, looking for pain, any tenderness, any masses, or any muscle gardening. You didn't feel any of that, okay? So next, I'm gonna be moving into deep palpation. Now for deep palpation, I'm gonna have the patient bend his knee for me, which help relaxes the abdominal musculature area, allowing for a deep increase. Because the deep palpation is a bimanual movement, meaning that I'm gonna be using both of my hand, and I'm gonna go 1 inch into the tissue. Again, I'm gonna be feeling for pain, any tenderness, any masses, and so on. All right, so for this one here, both of your knees, can you bring both of them up? Thank you. So starting at the lower quadrant. I'm doing 3 spots per quadrant. Moving to the lower quadrant. And I'm doing that bilaterally as well. Again, I'm feeling for any type of pain, any tenderness, any masses, or any muscle guards. Next, I'm going to demonstrate how to identify between superficial and deep masses. So what I will do is I'm going to use the rectus abdominal area. So let's pretend I find a mass around the rectus abdominal area. I will tell my patient to take a seat up for me. Okay, and then I will palpate the area. Go ahead and relax. So for superficial, the area will most likely be more palpatable. I should be able to see it. It's visual. Now for deep, I would not be able to see it, and I should not be able to palpate it easy. So then I'm gonna move to the palpation of the liver. So to do that, I'm gonna lift up the tissue area underneath the rib cage. And I'm gonna be using a flat hand around the umbilicus. I'm going to be moving up toward the costal margin. Now that I'm here at the costal margin, I'm gonna have my patient take a deep breath and palpate the area. Again, that's the palpation of the liver. So next thing I'm going to be doing is palpating the spleen. So I'm gonna come here around the rib cage area, just like so. I'm going to, actually using one hand, I'm gonna have the patient take a deep breath for me. All right, palpating the spleen. Now I'm going to be moving on to my tests. And the first test I'm going to be doing is rebound tenderness. For the rebound tenderness, I'm going to be using one hand going down into the tissue. Now, I'm going to start at the lower quadrant. Very light. So basically I'm going in slowly and release fast. All right, there's two signs that I'm looking for. For Bloomberg's sign, if the patient has any pain during the tenderness test, in any of the four quadrants, it will indicate that the patient has possible peritonitis. Now, if the patient were to have pain in the right upper quadrant, that will indicate that the patient is positive for appendicitis. Right? So next is the psoas test. And for the psoas test, I'm going to be taking one of my hands, placing it right at the ASIS. And I'm going to be using the other hand, placing it at the distal femur. And as I press down, I'm going to be having the patient lift his leg against my hand. Can you lift your leg against my hand? Just like so. And relax. Right. For the psoas, positive will be if the patient has pain in the right lower quadrant, that would indicate appendicitis. So the next exam I'm going to move to is the obturator sign. For the obturator sign, I'm going to lift the patient's leg, bend it for me at a 90-degree angle, right so, and I'm going to be stabilizing here. So what I'm going to do is, as I press this way, you press against my hand, okay? Ready? Okay? And next, as I'm going to press this way, you try to bring your leg back towards you, okay? Relax. All right, that will be the obturator sign. Now, if the patient have pain in the right lower quadrant, it will indicate that the patient have a pelvic abscess or rupture of the appendix. All right, so next is Murphy's punch. For that, I'm gonna have my patient sit up for me, facing the wall. I'm going to have you lift up your shirt for me. Okay, that's good. I'm going to use my hand over the kidney, and I'm going to use the other hand for a light punch. Let me know. You feel that? Murphy's punch. A positive would be pain over that area which will indicate possible nephritis.